in the Faculty of Applied Health Sciences, and I'm the director of the Center for Adapted Physical Activity, a new research center that is sponsoring a series of webinars this term after a successful round of webinars last term. And today we are delighted to have a Brock alumna with us, Bri Redquest. Bri was part of our S.N.A.P program many years ago, kind of got her feet wet in adapted physical activity. And actually, you know, I think maybe that was kind of the little trigger that got you going into your interest area, right? Working in S.N.A.P. And that was so cool. And then she went on to do work at Laurier with two excellent colleagues of ours. And I was lucky enough to be part of her committee. And so it's great to have Brianne with us. She is a postdoc at Calgary, and she's going to be presenting today on physical activity with neurodiverse populations. Before we get going, I also want to do a land acknowledgement and say that Brock University exists on the lands of the Haudenosaunee and Anishinaabe peoples, and that our quality of life and our ability to teach the way we do is connected to the legacy of our Indigenous peoples. And it remains our delight, really, and honor to engage with Indigenous people and Indigenous faculty as we continue to do land-based and decolonized engagement at our institution. So thanks for being here today, everyone. Brianne is going to present, and then we are going to have an opportunity for questions and interaction. We are recording this session, so if you don't want anyone to see your face, don't turn on your camera. And I will turn it over to Bri. And for the sake of today's presentation, Elise will be facilitating and moving the slides. So you'll hear Bri giving her cues and prompts when to move the slides over. So over to you, Bri.
Thanks so much, Maureen. Wow, it is so nice to be here. I just feel like a bit of nostalgia from Brock University. Oh, it's so lovely. Anyways, let's jump into things. So the topic that I'm presenting on is something that I'm extremely passionate about. It is physical activity among neurodiverse populations. And we can go to the next slide. So first of all, before we get into the fun stuff, who am I? So as Maureen mentioned, I went to Brock University, and she is most definitely correct. It was at Brock University with Maureen that really inspired my passion in this field. As I was getting ready today, I was really reflecting on that, and I was thinking, how interesting is it that the most influential moments are the ones that we least expect? Like, it was enrolling in Maureen's class, where I got to volunteer at S.N.A.P, which is an adapted physical activity program for people with disabilities. Sorry. That really directed my whole career, and that's why I am where I am today. So that's pretty magical. Anyways, after doing S.N.A.P, I knew I was extremely interested in learning more about this population. So I went on to do a master's and a PhD at Wilfrid Laurier, where my research focused on developmental disabilities. And then I did a postdoc at the Center for Addiction and Mental Health, where it also focused on disabilities, less on the physical activity side, but more on mental health interventions for adults with disabilities. So it was interesting because I had this unique experience at Brock and Wilfrid Laurier, but mostly focusing on younger guys with disabilities. So when I went to CAMH, I focused on adults, which was neat because then I got that experience across the lifespan. Excuse me. Currently, I'm at University of Calgary doing my second postdoctoral fellow with Dr. Carly McMorris, and here I am going back to physical activity. So I'm looking at physical activity interventions, specifically as a mental health intervention for neurodiverse populations. So as I'm sure you've gathered now, my research uses a multidisciplinary. So what I mean by that is, in addition to my background in kinesiology, I also pull from disciplines including social work and psychology. I use a community engaged approach. So alongside my research team and myself, I work with neurodiverse populations, so including the individuals themselves and caregivers to inform my research. And the overall goal of my research is really to explore, understand the well-being of people with neurodevelopmental disabilities as well as their family members, and discover ways that we can improve that well-being. In addition to my research, I'm extremely passionate about community engagement. So I have some experience in leading adapted physical activity programs, which directly resulted from my experience at S.N.A.P. So myself and a colleague, Dr. Nicole Reinders, developed and implemented a program, an adaptive physical activity program for kids with disabilities, which I'll be talking about today, called Movin' and Groovin'. We also led a great camp called Bodyworks. And then in addition to that, just recently, actually not recent anymore, when the pandemic hit, understanding that people had less access to physical activity resources, colleague Dr. Patrick Chikshira and I developed a virtual program called Fit Friday for people with disabilities. And that was super fun. And I think just as important as my research and community engagement, I like to have fun. So what do I do for fun? I love hiking, I love snowboarding, and I love being outside, which is one of the reasons why I'm here in Calgary. So thanks, Elise. So what am I talking to you guys about today? So I've broken the presentation into 3 parts. The first is background in neurodiverse populations. So I'm going to just briefly give some context to the population I'm talking about. And then we're going to talk a little bit about physical activity among diverse populations. And then finally, we're going to end as reviewing research regarding physical activity as a mental health intervention. So we're going to talk about next steps, which I hope really initiates some conversation with everybody. And then, of course, we'll end with concluding thoughts. So I might use the term our acronym PA, and when I say that, I mean physical activity. I encourage anybody who has questions throughout, please interrupt, put up your hand, use the chat. If I don't see it right away, I will definitely attend to it after the presentation. Okay, let's go. Okay, part 1. So background on neurodiverse populations. So what am I talking about when I'm talking about neurodiverse populations? And Elise, if you don't mind switching the slide. So I most often refer to neurodevelopmental disabilities. So by that, it encompasses a wide range of different disabilities, including ADHD, autism, learning disabilities, intellectual disabilities, and cerebral palsy. And that's just to name a few. So what's the prevalence rate? In Canada, it's quite high, so it's 10 to 17% of kids aged 4 to 14 have a neurodevelopmental disability. In US, I was just reading some research, it is 1 in 6 children. So it is quite high, and I'm sure that we all know somebody who has a neurodevelopmental disability. What are some common characteristics? And because we're talking about a wide range of disabilities, I've just pulled out something that I think characterizes all these disabilities. So often they experience challenges in personal, social, and academic and occupational functioning. However, that's not always inherent to their disability. It's largely because we live in an inaccessible society to neurodivergent individuals. We do not, our society just really is not accessible towards them, hence why they experience challenges. And in addition, I always like highlighting their several strengths. So they have tons of strength, and I could have discussed the whole presentation on their strengths, but I've only pulled out a few. So they often think and learn in a visual way, memorize and learn information quickly. They tend to be very punctual, friendly, and determined. And again, those are just very few strengths of several others. So we can proceed. So as much as I could continue talking about neurodiverse populations, I just want to jump into comorbid conditions because you'll see how this relates to the presentation here today. So neurodivergent individuals are often diagnosed with comorbid conditions. So what do I mean by that? What I mean is, in addition to their primary diagnosis, so such as autism, they have additional diagnoses. And these diagnoses are usually physical and mental health concerns. And what we do know is, compared to the general population, they have higher rates of physical and mental health concerns. So let's look a little deeper into this. So physical health concerns. And again, I've only pulled a few from the literature just to show some examples. So let's look at asthma for an example. The research shows that 35% increased risk among autistic people versus their non-autistic peers. If we look at diabetes, 16% among people with disabilities versus 10 without. Migraines, people with ADHD have an increased risk of 70%. And then other common physical health issues include epilepsy, heart issues, and dementia we see often in Down syndrome, cancers, and GI complications. So from this slide, we can see that they are at a higher risk of developing physical health issues. Now, the unfortunate thing is we don't always have the supports and the treatment tailored to their needs. So let's say diabetes, for an example. I've done some work in the diabetes world. And it's quite, I want to use the right term here, frustrating, because we see consistently that these guys have much higher rates of diabetes. Now, if you look at the diabetes guidelines, and you can look at essentially any type of guidelines, so UK, Canada, and you will notice that, unfortunately, we do not have treatment specific towards these guys. So all the guidelines are really based on able-bodied populations and not neurodivergent individuals. So hopefully we're recognizing this, we're creating awareness, and we'll start to see care that is tailored to their needs. So that's physical health. Now let's move on to mental health. So mental health is a little bit closer to my area of research. And will be more of a focus of this presentation. So with mental health, we see, again, higher rates of mental health concerns among neurodivergent individuals. Common mental health concerns include depression and anxiety. Now I've included some stats on this slide. So let's look at FASD. So the research shows us that 90% of people with FASD have a mental health issue. Now, that's a lot. Depression and mood and anxiety disorders are the most common. And if we look at the autistic population, we actually see 79% of autistic people have a mental health issue. So that includes depression and anxiety as most common. And then in addition to depression and anxiety, we see several other mental health issues. So we see higher suicide rates, we see higher addiction, higher rates of behavioral or conduct disorders. So I want to definitely highlight that this is individualized. Just because somebody has a neurodevelopmental disability doesn't always mean that they're going to have, suicidal ideations, but I am emphasizing that it is more common in these populations. And I do think that it's important to talk about the COVID-19 pandemic, and I'm sure we're all kind of sick of talking about it, but I don't think that we can talk about mental health concerns without talking about the pandemic. I mean, it's been pretty impactful. So maybe I'll open this up to the audience. Do I have access? Oh, I have access to the chat. Great. Awesome. What do you guys think has maybe I should rephrase this. How do you think the COVID-19 pandemic has impacted the mental health of neurodivergent individuals? And feel free to unmute yourself as well, if you can. I'm not sure if you have access to that. Okay, so maybe I'm just going to assume that you guys don't have access to the chat, and that's why you're not answering. Oh, isolation, lack of access. Yes, negatively. Less resources and community that folks rely on. Isolation, lack of access. Exactly. So we're actually seeing a harder hit to the mental health right now. I think it's greatly impacted people. They're more isolated and they don't have an ability to access resources and supports. And their caregivers are struggling, absolutely. Loss of structure, engagement with peers. So yes, exactly, that's what we are seeing. So a lot of individuals have lost their support, so they have this disruption in their structure. A lot of them weren't able to see family and friends, and some people didn't really understand what was going on. So their family wasn't visiting them, and they kind of thought, what is going on? And then, of course, vaccinations posed another huge issue. So despite being a vulnerable population and despite research showing that these guys were more vulnerable to COVID, and should they get it, they had a higher risk of death, we still did not make them a priority population for vaccinations, which of course would impact their mental health, and if not their mental health, then their caregivers who are tirelessly advocating for them. So I think now more than ever, what we're seeing is the challenges that existed prior to the pandemic, mental health challenges, we're seeing those exacerbated. So there is more of an urgency to attend to their care and more importantly, provide them with some type of intervention for their mental health in the midst of the pandemic, but also post-pandemic. Thanks, Lise. So, unfortunately, currently as it stands, I'm just going to exit my chat here. As it stands, there are limited mental health interventions that are tailored to neurodiverse populations. So what I mean is that mental health interventions are really developed and implemented with the mindset that they are for neurotypical individuals. So they don't consider the unique needs of this population. They're costly and they have super long wait lists. And then I think the one point that I hope comes across in this presentation, because it is so important, is that these existing mental health interventions are often rarely informed by the neurodiverse population. So what I mean by that is kind of when I spoke about my research, saying that I use a community engaged approach, or some people say patient engagement framework, where we work alongside neurodivergent individuals so that they can inform what they need, and it improves the accessibility of these interventions. But we're not getting their feedback and we're not taking into account their opinions. So we develop these interventions without their input. So hopefully that is changing or will change. So let's move to the next part of the presentation, which is looking at physical activity as a mental health intervention. So before I get into that, I think it's important to highlight just a little bit about physical activity. So looking at different levels, barriers, and the benefits relating to this population. So something really interesting happened this week. Up until this point, most research has relied on the World Health Organization's guidelines for children and adolescents living with disabilities. Now, these guidelines state that the neurodiverse population needs at least 60 minutes a day of moderate to vigorous intensity of physical activity. And then I think it was, so I had all my slides prepped and I had all these studies showing that they're not meeting these WHO guidelines. And then I was scrolling through Twitter and I see the UK, researchers from the UK develop new guidelines. And I click them and it's a huge game changer. So Lisa, if you just press next, I'm gonna have some spontaneous slide. Yep, there we go, some animation. They came up with new guidelines. So I was really interested. I read their whole report and I'm like, how did they get to only 20 minutes? And the WHO, World Health Organization, states that they need 60 minutes. 60 versus 20 is a big discrepancy. From what I understand, and this is all new research that I'm still looking into, the WHO guidelines actually were not evidence-based. So what I mean by that is when WHO came out and said disabled children need 60 minutes of physical activity per day, where they got that number was not actually on studies for disabled children. So the researchers from the UK said, we got to fix this. They did this rapid review of research, and ultimately what they found is 20 minutes of physical activity a day actually leads to health benefits among this population. And how they, with regards to messaging, they say you can do bite-sized chunks of physical activity throughout the day. And then, of course, this is consistent with the WHO guidelines, but they do also suggest strength and balance activities 3 times per week. So again, this is a game changer. So a lot of the research has said that these guys are not meeting guidelines of the 60 minutes a day. So I went back in that research and I wanted to see when they reported the time. And in most cases, not all, these guys are actually meeting the 20 minutes. So that's good news. That's really good news. And we can switch slides. So I had to be a little bit careful with this next slide, because I didn't want to say that they weren't meeting the guidelines, because now it's kind of changing. So how we interpret that research is going to be a little bit different. However, there is some consistency and validation when we say neurodivergent children and youth are less active than their peers. So they are more sedentary, they engage in a lot more screen activity. We also know as they age, their PA levels decrease even more. Additional factors that impact their PA levels. Now there's tons of different factors. However, I've just pulled on these. So mother's education. So the lower the mother's education is associated with lower PA levels in this population. More comorbid conditions. We see lower levels of PA. Disability severity. So more increased severity is translated to less PA. And then, of course, as I'm sure you all suspect, lack of social support also translates to less PA. So what I want to highlight, something that is, so this is all quite alarming, because if you go back to my previous slides looking at physical and mental health, we actually know that this population is worse off when we look at those outcomes. And we also know from research that physical activity is really good and it can act as a protective barrier against a lot of these mental and physical health issues, but they're less active, which isn't good. So that's alarming. But what also is really alarming is that this is in children and youth. So why is that alarming? It's alarming because during this age, this is a huge milestone where we develop a lot of habits that we carry on and track into our adulthood. So if we see that children and youth are less active, then we can expect or hypothesize that they're also going to carry this sedentary behavior into adulthood. And of course, at least if you just hit this slide, this is confirmed, because we know as they age, their PA levels decrease. So by trying to address the lack of physical activity amongst this population, we're addressing a current issue, but we're also going to address a future issue. And you can keep clicking. So I just wanted to emphasize that this is really spread across all disabilities. It's not discriminated to just one disability, but we see it in intellectual disabilities. We see it in Down syndrome, and you can hit, I think you got 2 more clicks. You see it in cerebral palsy, and you see it in autism. So all in all, we do know that neurodivergent individuals are less active than their peers. We know that they engage in more sedentary behavior, so that is usually defined as screen time. So it's important that we address this. And I think you can click, yeah. But I think that it's not, I don't think that we can have this discussion without highlighting that, the low levels of PA that we see in this population are likely due to the tremendous amount of barriers that they experience to PA. So Martin Guinness Shields have done an extensive research in this area. And typically across all research, we see a lot of the same barriers that are categorized in 4 different categories. So let's go through the first one first. This is personal, so lack of knowledge/skill. And this makes sense. So I think as a kinesiology, as somebody who has a background in kinesiology, I took for granted how much I really did know about physical activity and how to exercise. And I started to understand that when people lacked that knowledge and those skills, they were less hesitant to be physically active, which makes total sense. I lack musical skills. I'm not going to pick up a guitar and go play a guitar, right? And so we have to be sure to address that barrier. Fear, so there's fear in there's fear in a lot of different ways. So fear of being bullied, fear of injury, and then of course preference. And I think that this isn't specific just to this population, but a lot of people just don't prefer physical activity. They'd rather sit on the couch and watch Netflix, and that's completely okay. But we just have to find ways to incorporate, chunk-sized bites, I think was what the physical activity guidelines said, a physical activity into the day. Let's look at policy and program. So we do see a lack of programs for people with disabilities. We also see that when there are programs, they tend to be team sports, which might not always lend themselves to the interest of the people with disabilities. So what I mean by that is that perhaps they prefer individual sports, but that option is not available. Lack of staff capacity. So the people that are leading these programs might not have a background in disabilities. So they might actually not know how to adapt the sport or physical activity to the individual or participant with a disability. Environment. So inadequate facilities is a huge one. And I'm not just talking about accessibility in terms of stairs for people in wheelchairs, but I'm also talking about in a gym setting. So you go to a gym, bright lights, loud noises, there's usually an echo in the gym. Again, so an individual who might have sensory sensitivities, it's not an accessible facility. It's not the ideal place for them to engage in physical activity. Transportation is huge, so they might not have access to transportation. So then they have to take a bus, and again, hopping on a bus isn't so easy for somebody who might have some physical limitations. And that adds a lot of time into the day, which leads me to my last category, which is social. Time constraints. So in addition to physical activity, it's also important that they engage in a lot of different therapies, such as physical therapy, occupational therapy, speech and language. So to fit something else today can be difficult. So that is definitely parental concerns. So parents might be concerned that their child might get an injury or be bullied, also acting as a barrier. And then lastly, if they don't have that social support of friends to attend with them, it's always easier to go places with friends, isn't it? So if you lack that, again, you might be less hesitant to engage in some type of sporting event. So I hope that I've made a strong case to justify, of course they have low levels of PA. Look at all these barriers, right? So as researchers and as individuals in this field, it's really important that we address these barriers and provide accessible and inclusive opportunities to ensure that they can be active. And I think, Lacey, yep, perfect. And why? Well, there's tremendous amounts of benefits of physical activity for everybody. So if we look at the research just on neurodiverse populations, we see endless amounts of benefits. We know that PA benefits physical and mental health. It improves social skills. It improves motor skills. There's a ton of studies looking at academic performance. So more physical activity, we see higher attendance rates. We see cognitive improvements, so grades going up. Sleep quality and quantity is improved with PA. Interestingly, I think it was just last week, a study just got published, and it looked at exercise in autistic populations. And what they found is that it increased melatonin, which in turn increased both sleep quality and quantity. So this is definitely an area of research that's gaining a lot of traction right now. And pain. So a lot of research around physical activity in individuals with cerebral palsy who experience a lot of pain. We see that their pain is decreased with physical activity. So I think it's a strong case. I don't think anybody would try to dispute that physical activity is not beneficial to neurodivergent individuals. But as I mentioned, as much as I'd love to explore and talk about all these benefits because it's very exciting, I'm going to just focus on mental health. Thanks, Lise. So, part 3. Physical activity as a mental health intervention. So for this part, I'm going to review some of my current research and discuss why I think and the body of research suggests that physical activity is indeed a promising mental health intervention for the neurodiverse population. Okay, so just a little bit of a background in case you missed out on the first few slides, and just as a reminder, we know with confidence that neurodivergent children and youth do have higher rates of mental health issues when compared to the general population. So if we look at statistics across all disabilities, usually we see 50 to 90% of neurodivergent individuals report having a mental health issue, and depression and anxiety tend to be the most common. So my colleagues at U Calgary and I conducted a systematic review. So what I mean by a systematic review is we looked at through all the research in the area of physical activity on psychological well-being in children with autism and or intellectual disabilities. We took all the studies that looked at that, and then we provided some type of conclusion. So what are these studies saying? Unfortunately, we haven't submitted it yet, but it is so close. We're just about to submit. And let's look at the findings. So again, the purpose was to examine the impact of physical activity on the mental health of psychological well-being of children and youth with autism and or intellectual disabilities. So we looked at individuals ages between 5 to 25. And what we found is there is limited research, but there were 7 studies. So we took those 7 studies and we really reviewed what they were saying. All studies utilized a group intervention involved structured programming. So there was no individual interventions. It was all structured programming. So I provide some examples here. There was yoga, football, swimming. There is another one that was really interesting. It was exergaming. So there was a bunch of different activities, but it was all group-based. In terms of frequency, that did vary as well. So we saw interventions varied from 10 days, so that was like a 10-day camp, to 48 weeks. So the 48-week study, that was twice a week, 40 minutes for 48 weeks. The similarity or commonality amongst all these studies is that they did look at mental health and mental wellness and the impact of physical activity. So how did physical activity impact mental health and mental wellness? So what did we find? We found that, as we expected, that all studies reported improvements in mental health. So they did look at different areas of mental health, but overall, what we saw was decreases in stress and anxiety, internalizing behaviors. We saw increases in well-being, quality of life, and emotional stability. So all in all, results strongly indicate that physical activity is an effective mental health intervention for this population. And yeah, but this led us to our next question, which is what is contributing to these mental health benefits? And you might ask why? Why would we want to know that? Well, if we can identify which factors promote mental health in sport, then we can create some type of model or some type of framework that we can apply to sport to be confident that individuals engaging in that sport will have mental health benefits. So this led us to our next study. So just a background of this study, because it was done with Special Olympics. So I'm just going to give a very brief background of what we know about participation in Special Olympics. So the studies show, there's been several reviews that show participation in Special Olympics does indeed increase mental health. So we see participants do report increases in self-perception, quality of life, positive emotions like having fun, and then reductions in aggression. So this is really great, but the question is, so why? Why do they come out with better mental health? What is happening? So the purpose of our study was to examine the mental health benefits of Special Olympics participation and what factors contribute to these benefits. And of course, we used a patient engagement framework. So all interview guides, all surveys were completed alongside my wonderful research colleagues, who consisted of two amazing Special Olympic athletes and their caregivers. So they helped me create that interview guide so that it was more accessible to athletes and caregivers and coaches. So we can go to the next slide, Elise. Thank you. So what are we hearing so far? So this is definitely in its early stages. So we're still in the process of conducting this study, but we're finding some really exciting things. So what are we hearing? What we are hearing is that there's these internal factors as well as external factors that are contributing to mental health. So let's look at internal factors first. Athletes say that they feel this really strong sense of belongingness. So when they're there, they feel welcomed, they feel accepted, they can connect to their peers, which in turn advances their mental health or promotes their mental health. It's really also interesting because we talked a lot about skill development with these athletes. So what we were hearing is that they'd engage in a new sport, say it was bowling, and maybe they weren't that great at it, but with persistence and determination, they developed this really strong skill set in that area, whichever area of sport they were talking about, which again improved their mental health. And then they really appreciated the challenge. So they liked being challenged. They liked trying to refine their skills and learn new skills. And then, of course, there were external factors. So this idea of skill transfer was really talked about. And it wasn't necessarily physical skill, but it was life skills. So the lady that I'm working with, who's a Special Olympic athlete, gave me a really good example of this. So she talked about being involved in Special Olympics, encouraged that she had to get there. She couldn't let people down. She had to get there on time. She had to be organized. She had to show up. She had to work with teammates. And in doing so, she was able to transfer these skills into the real world, particularly when she was applying for jobs. So these were skills that she put on her resume. Within Special Olympics, there's a ton of community engagement through various fundraising opportunities that they also thoroughly enjoyed and said made them happier. Unfortunately, right now, this isn't as applicable, but within Special Olympics, a lot of the athletes will travel across countries. I think one year there was something in China, which also the excitement of that, and they said, in often cases, they wouldn't have the opportunity to travel to these different countries, again, improve their mental health. But I do want to emphasize that this is in its early stages. We're still learning. We're just beginning really the interview process, but we are finding a lot of exciting things. And why, sorry, Elise, if you don't mind going back. Yeah. So why are we doing this? Again, just to emphasize, it's guiding sport development and programming for neurodiverse populations. So not only will it improve mental health, but maybe it will get the messaging across of PA is important. So it may increase PA engagement amongst this population as well. So those are the direct impacts of very many. We just went over those two ones. But something that I find quite interesting, and I've been quite invested in, is the indirect impact of PA on mental health. So this idea of, first of all, it acts as a setting for early identification. So coaches are in this really unique position to identify mental health concerns amongst their athletes. So say John's coming to practice. He's really social, he talks to his friends, and he gets that basketball and he plays right away. That's typical John. A few weeks later, John comes in late, he's sluggish, he sits on the bench, and he's not talking. That coach is in a unique position to notice there's a shift with John and perhaps to talk to John about what's going on. It's also an ideal setting to teach about mental health literacy. So what do I mean by mental health literacy? What I mean by that is being able to be aware when your mental health shifts. So for an example, if my typical routine is waking up at 8 a.m., I go for a run, I talk to my friends, and then I read a book. Weeks later, I'm sleeping until 12. I don't want to read. I have not engaged in any physical activity. It might be a red flag to me to say, something's a little off. Maybe I'm depressed right now. And then it encourages me to get some help. So teaching those red flags and teaching those signs to athletes is really important. So I do think that sport offers this unique setting to teach that to athletes with disabilities. Which led us to my next project, which is called Understanding My Strong Mind. So my colleagues at the Center for Addiction and Mental Health created this, and colleagues across Canada, really, because I was also working with Dr. McMorris, who's here in U Calgary. And we created this tool called Understanding My Strong Mind. And we did it alongside Special Olympic athletes, so everything you see was informed by Special Olympic athletes and coaches. Now, what this tool is it's identifying everybody's baseline. So an athlete would fill this out when they feel okay. They shouldn't feel extra happy, they wouldn't feel sad, and if they were, then they would be asked to fill the tool out at a different time. So this tool assesses a wide range of areas, which you'll see on my next slide, just to get their baseline. So kind of what I mentioned about John before, we knew his baseline was coming, he was happy, he played basketball. However, it's important to know that everybody's baseline is different. So my baseline might be what I said earlier. I wake up at 8, I go for a run, I read a book, and that's my baseline. That's what I do when I feel okay. However, my friend Sam, her baseline might be sleeping till 12, and then she watches some Netflix and she stays up really late, but that's her normal baseline. So everybody's normal is different. And it's important to understand everybody's baseline. So when they deviate from that, we can red flag it, and then we can recognize that maybe they might need some support. So that's what this tool is doing. We ask athletes to complete it, and then coaches would have access to this so that if they notice something, off in an athlete, they can pull up this tool, look at it, and say, oh, never mind, this is John's typical personality, it's okay. Or this is not what John looks like when he's okay, so let's direct him to the right supports. So what does the tool look like? And we can go to the next slide, Elise. So there's different sections. So communication was one section that we included. And again, just to reiterate, all the sections were informed by Special Olympic athletes as well as researchers, and then of course what we read in the literature. So we talked about communication, and then you can click through, Elise. We also asked about relationships. So for an example, here we see a question that says, do you talk to yourself? If this was a no for somebody and you started seeing that they were talking to themselves, then you would probably direct them to some resources. However, on the contrary, if you saw somebody talk to themselves and you looked at this and this was typical behavior, then you wouldn't red flag it. So this looked at relationships. We asked about staying healthy. So what do they do to stay healthy? We asked about looking after themselves. We asked, how they feel, so a little bit about their physical health. And then finally, my personal favorite page, we wanted to end things on a good note by asking about the best parts of themselves. So hopefully this tool will be impactful in at least identifying early mental health concerns. That way we can get them the right supports, because we know the earlier intervention is implemented, the more successful the outcome. So the evidence is there. Physical activity can improve the mental health of neurodivergent individuals. So this is all great, and this is more research-based, but it is so important that we don't let our research just sit in journals and we actually implement it into practice. So let's move this all into practice and see what we can do to get this population active. So I think the first step is that we talked about a lot of those barriers is addressing those barriers by creating accessible opportunities. And the good news is so many wonderful people are doing this. So for an example, Center for Excellence in Inclusive and Adaptive Physical Activity, why we're here today, is a great center who does incredible research and offers tremendous programming for neurodivergent individuals. And this comes in different forms, right? So we also see the Calgary Adapted Hub, which is a great initiative. And what they've done is they've taken all the accessible and adapted sports in Calgary and they put it into one location. So if caregivers or a neurodivergent individual wanted to look for a program, it's kind of like a one-stop shop. They can look, identify their program, and then find, register, because what we were seeing is that people didn't really know what was available. So the Calgary Adapted Hub definitely addresses this barrier. And then again, different forms. So the Apex is done by Dr. Chad Sutherland at Windsor, and this is a great manual who has that consists of tons of different adaptive physical activities for adults with intellectual and developmental disabilities. Kappa, which is here in Calgary. I got the great opportunity of volunteering there. It's a program that's offered on weekends that consists of different adaptive physical activities for children with developmental disabilities. So there's an hour of swimming and then an hour of sport. Super fun. And then, of course, I have to talk about my work through Laurier. So again, as I mentioned at the beginning of this presentation, myself and Dr. Reinders created this super awesome program called Moving and Grooving. So I'm going to discuss that a bit, Elise, if you don't mind. Thanks. So a little bit about the program. So we developed it, I believe, back in 2016 or 2017, and it was for children with developmental disabilities, but we kept kind of tailoring it with what we learned. So initially, I think we were offering it twice a week for 1 hour a week. We found that wasn't as effective because we'd have either one busy night and then one super not busy night. So then we ended up just offering it once a week. We also played around with enrollment. So I think we started with maybe 20 people, and then we thought that was too many people, so we reduced registration down to between 12 and 15. So just recently, Nicole and I wrote a paper describing Moving and Grooving and what we thought made it successful. And I do want to highlight much of what we learned and implemented in this program was because of Dr. Maureen Connolly and what I learned during S.N.A.P. So we identified 11 successful ingredients. I wish I could talk about all of them, but I can't due to time restrictions. So I have just highlighted 4 that I'm going to talk about. And Elise, if you just don't mind clicking. There we go. So I think what truly made it successful was a small class size. So like I mentioned, we started too high. I think we had like 20. We reduced it between 10 and 15. Now, by doing that, it allowed more one-on-one support with these children, which I think was great in terms of socialization, but it also allowed their physical abilities and physical skill set to be more closely monitored. As all my work is, it was participant informed. So much of the activities and what we were doing was through constant feedback with the participants. So the little guys themselves, but also their caregivers. So we would say, what did you like about today's session? What they liked, we'd jot down, we'd put a star, knowing that was something we'd probably keep in the program. And then we'd say, what don't you like about the program? And those are things that we most likely took out. So one thing that we learned in talking to caregivers, because most often after Moving and Grooving, we spent quite a while just touching base with caregivers, getting their input on the program. So one thing we learned is the kids, we would end the last 10 minutes with free time. So most likely it was tagged. Everybody was wild. It was pretty chaotic, but it was the last 10 minutes. So we thought it was okay. What we heard from caregivers is they said, when we pick up our son or daughter, they are on fire, like they're so hyper. It's 7 p.m. at night. We got to get them to bed, and it's really hard. So what we did is we started implementing the last 10 minutes of relaxation. So we do activities like yoga and mindfulness, which was huge. And we heard from caregivers that it was much more effective that way. Something that I am extremely passionate about is providing opportunities and encouraging independence and autonomy amongst neurodivergent individuals. So what we did is our program was up to about 16. Sometimes we're a little bit loose with that. But once our guys turn 16, what happens in the real world is often services and supports become they're not offered as much as to younger kids. So we see that individuals with disabilities kind of grow out of their supports, which is unfortunate because just because they're aging doesn't mean that they shouldn't have these supports. So what we did is once they aged out of our program, we said, hey, why don't you come back and be a volunteer? So the participants themselves started volunteering and offering one-on-one support to our participants. And as a thank you, we always provided and compensated them for their time in the means of an honorarium. An area of my research has definitely been siblings. So it was important to me to also include their siblings, whether they had a disability or not. And I think that was beneficial for several reasons. So what we know from the literature is often siblings are kind of feeling excluded within the family. So we were able to provide this one-on-one attention that unfortunately they don't always get. The other benefit of that is that it provided some type of respite for their parents. So the parents were able to drop off both their kids, and then they had this hour of free time. So stay tuned, that paper should be coming out really soon. And it's an exciting paper because Moving and Groovin' was a huge passion of mine and has inspired much of my work. So in ending, I think that we've done a lot of work in this area, and there are so many intelligent people who are incredibly passionate about adaptive physical activity and using it as a mental health intervention. But that doesn't mean that there's things that we don't have to do. There's still a lot of things we got to do. The first is, how do we get the messaging across? So I've been really interested in this because, again, not all of this is common knowledge. So how do we stress the importance of physical activity to neurodiverse populations and their family members? The next is, how do we empower people to become active? So we have these guidelines. We have some accessible, adapted physical activity programming, but unless people feel confident and empowered, they're not going to be active. So we have to learn how to empower people to become active. And with these new guidelines, I do wonder if that's going to be easier. So initially, who recommended 60 minutes? When people see 60 minutes, it's intimidating. It's like, holy crap, 60 minutes? I don't know if I want to be, first of all, I don't know if I want to engage in physical activity that long. Secondly, I don't know if I have time. Now that it's 20 minutes a day, I wonder if this is going to encourage people to engage in the physical activity, knowing that it's not too much of a time muncher. And then, of course, so a lot of what we see in the research is the interventions, as you saw on my previous slide, are between 10 days to 48 weeks. So 48 weeks is an exception, and that is quite long, but usually they range from 10 days to about 8 weeks. It's important that after they engage in that program, that they sustain physical activity. We can't just say, okay, so they came to our program, they were physically active, they had these outcomes, but we know for those outcomes to be maintained, they have to consistently engage in physical activity. So how can we make sure that these children and youth adapt this into their lifestyle and engage in physical activity lifelong? So that's definitely another area we want to research. So all in all, PA is most definitely a promising mental health intervention for neurodiverse populations. I want to highlight that research and practice, so program development and execution, any knowledge translation initiatives need to be done together. So that means researchers working alongside neurodivergent individuals as well as their caregivers to inform what they're doing and making sure that it's accessible to that population, enjoyed by that population, and of course, feasible. Great work being done. We know that there's still more work to do, but I think with these new guidelines coming out, amazing researchers in this field, the future is most definitely bright. And I do think that we will see impact, real life impact from this research. And I think that's a wrap. Thank you so much for listening. I hope that everybody learned stuff. And I'd love to open it up to questions or just a discussion.
Thanks, Brianne. Great presentation. Yay.
Yeah.
Yeah, so I'm hoping we do have some questions and comments. I have a question. Maybe you don't mind if I start you off.
Please.
And one of the things that I noticed was the that many of the programs that you're doing and many of the programs that I do are what would be considered segregated programs.
Right.
The siblings are there, right? But the sibs are always there. So a lot of our programs are what many would consider to be segregated. And we've also had presentations from programs like multi-sport, where we've got integrated or often inclusive kinds of approaches. So I guess I'm wondering about this whole idea of the large critique of segregated programs, generally speaking, yet the significant mental health benefits that seem to exist inside segregated programs. Maybe that's something that we could think about in terms of ongoing research or future research is how do you get that feel of community in the segregated setting in the so-called inclusive programs, right, where you've got individuals of many levels, both disabled and non-disabled people kind of engaging together. So what do you think about that? Like these programs that are largely, disabled communities kind of working with each other?
It's a really good question. And I go back and forth with it a lot, and I try to update myself on research within that area. And I'm well aware of, some of the critiques towards Special Olympics, right, being a segregated program. And I think that it's definitely individualized. I've spoken to different people, neurodivergent individuals who say, I don't want to go to Special Olympics. I don't want to be with them. I want to go and play soccer with like neurotypical guys. So I think it's individualized. I think it's up to the preference of the individual, and we have to recognize that and respect that. I don't know that one offers a stronger benefit over the other. I think that it's all individualized, and as long as people are provided the choice, then they can choose which one they want to go into. But definitely an interesting area. I think that, it requires more research and or understanding everybody's perspective in that area, especially neurodivergent individuals, would be quite imperative to direct us to what's better. Right?
Yeah, that's what the presenters who did multi-sport in January, they said very, very similar things, like they're all about the choice, right? So they're not saying make Special Olympics into multi-sport or make multi-sport into something else. Let's have options for disabled people, for neurodiverse people, just like there's loads of options for non-disabled people.
Mm-hmm. Yeah, and I think that there's still work to do, right? I think that we need to create awareness in schools about it, because if you read the research on PE classes and the perspective of disabled individuals in physical activity classes, it's quite negative. So I think there's still a lot of work of how we can increase awareness, acceptance, inclusion, and make sure that these programs are actually inclusive, right? In terms of adaptations and whatnot.
Yeah, so we got a question in the chat from Lauren. Do you have any suggestions to introduce group activity or sports to kids who typically prefer to play alone without overwhelming them? Or do you recommend that introducing physical activity to fit their needs, such as independent activities? How do we empower this child?
I think that is a really good question. And again, I'm going to answer it the same way that I answered yours. I think it's preference, and I think allowing that child to decide which they prefer. If they prefer individualized sport, put them in individualized sport. If they prefer team and socializing, then put them in socialized or team sport. I think it should be up to that child. I think that if they are already independent and maybe don't want to interact with other children, that's okay. And you can start them by playing soccer one-on-one with them. And perhaps by building their skill set in that specific sport of their choice, they might feel more empowered or confident to get into a team sport. But I think always respecting their choice is important.
Okay, we have a question from Jameson. Go ahead, Jameson, unmute yourself.
Hi there. Thanks so much. Just as a little bit of understanding from the perspective I'm offering, I work as a recreation therapist at the Niagara Children's Center, which is right across the street from Brock University. So I am familiar with the amazing work that's being done through S.N.A.P and all of that great stuff, Brock Niagara Penguins, etc. What I think is a piece for me working really with families who are new to recreation and leisure pursuits is kind of that sustainability part. So, me at the center as a clinician, I understand the neurodiversity and being able to provide intervention and program that way. But I hear from a lot of families that that transition to community programs can be really, really hard, and wanting to find those friendships and just that engagement in the community. So I'm not necessarily sure that it's a question, but more of like, do you have any kind of insight on how I can help to make that transition easier for these families when navigating community programs that would follow that same kind of, like that kind of inclusive look, or including siblings and just in the community? Like, that's really the tricky part that I'm finding.
So, sorry, maybe I'm not quite understanding. So is the difficulty around getting them adjusted to community programs or finding the correct community program?
It's a little bit of both, but I think that my question is more like finding that comfortability or being able to like identify like a way that their child's strengths can be engaged appropriately in the community. Like, I don't know, I find that that's really tricky for families. So I'm just curious if in any of your research anyone has kind of mentioned that, or if you know of kind of a way that I can support them in being able to kind of cross that boundary of like, this really works for me, but it's not always going to be there, right? Like, at some point from the children's center, they have to be able to kind of move on to those community-based engagements. And it's really tricky for some families to know how to do that.
Yeah, absolutely. What we see actually in research that tends to be quite beneficial there are some programs that will offer a collection of sports. So here in Calgary, we have a camp, and I think it's a 7-day camp or maybe 2-week camp, and they can test out all these different sports, and then they can kind of figure out where their strengths are and what they like. And I think if we can figure out their strengths and what they like, the transition tends to be a little bit easier. I think also a slow transition. I mean, if it's once a week and they can stay, we had some kiddos that could only stay for like 5 minutes, and that was okay. They got a taste of it. They got to slowly adjust, and one week it might be 5 minutes, and the next week it might be 10, and that would be huge, right? So slowly transitioning, and then of course having some familiarity. So having a sibling attend them. So seeking out programs that would be open to that. But I definitely want to emphasize that slow transition. I think that if we push, it's too much. And I'm sure Maureen could talk about that with S.N.A.P, right? So working with the child at their speed is definitely, and then trying to find out where their skills and passion are, and then including familiarity. So having the family there, sibling there to join them would be helpful.
Thanks, Brianne. Other questions or comments?
I do see Erica's question about, do you believe that educating neurotypical and neurodivergent children about disabilities and how we move our bodies differently may help the acceptance of PA over time? Yeah, I think that we should be educating that. I think we should be creating awareness about disability and how everybody's different. And this doesn't just pertain to disability, everybody's different. And emphasizing different is okay. And we do physically move different ways, and it doesn't make one person superior. So enhancing awareness about that, especially with regards to the physical education research. Sometimes it's sad reading the experiences and how misinformed some people are, right? So thinking people can't do things or thinking they're bad at them because they do them differently. I think increasing education around that is so important. And if we can do that, I think that we would see more PA in this population, particularly in the school setting.
Yeah. Thanks for that question, Erica. I agree with you, Brianne. I mean, I think one of the I'm working with a course right now, an online course, and we did a prompt a couple of weeks ago for one of our posts. And in the prompt, I said, most non-disabled people learn about disabled people through media or popular culture, not through actual interactions with disabled people in their lives. And why is that? Why is there so little kind of interaction between disabled people and non-disabled people? And it's still kind of intriguing. Like, what is that? Is it this sort of, I don't know, discomfort or awkwardness, trying to negotiate differentness, or what? But it's still the case. And the university students in my classes say the same thing. That's exactly right. I didn't have any friends who identified as disabled. I myself don't think it's unusual that I don't have friends who identify as disabled. They kind of exist in these two solitudes, but don't find it unusual. Like it's almost 25% of the population.
Absolutely.
And if we all live long enough, right, and don't die quickly, we're all going to experience disablement. It's not a thing that it's a human existence possibility, right? It's very strange how, like, these kind of interactions don't seem to happen.
It is indeed.
It is.
Hopefully we can change that.
Yeah, hopefully we can. Hopefully we can. Okay. Yeah, other questions, comments? Elise or Demi, do you have any questions? Or not so much questions, but comments, because some of Bri's programs are very similar to some of the programs that we're kind of running.
Yeah, I don't really have any questions. I think your presentation did a great job really laying everything out and explaining it all in good detail and stuff. And kind of like what we've all said, and I know it's a similar consensus across the board with a lot of these programs, is we know the benefits are there. It's just now trying to get everyone to get on board with making programs more accessible so we have more opportunity to provide for everyone. And so I think it's great hearing of other programs and initiatives being starting up everywhere, like a few that you mentioned. I wasn't even aware of a couple of them. So yeah, it's great to hear, and it's nice to always know when there's more growing. So thank you.
Of course, thank you.
Yeah.
Yeah, thanks, Brianne. It's nice to see you again.
Mm.
And it's nice to be able to listen to presentations that, of course, reiterate what we know, but then also include the knowledge translation piece and really connect to how we can take the theory and put it into practice, and what are the concrete actionable items we can take away from the research, I think is oftentimes what is missing. So thanks for that. And it's nice also to become aware of other resources and other organizations and other programs doing similar things, because we are such a small community, and yet we're always learning about these new things that exist that we didn't realize were out there. So I appreciate that, and I appreciate your continued partnership and support. I'm glad that we've been able to stay in touch and learn about what you've continued to do and how you've taken what you've learned at S.N.A.P to other places. That's awesome.
Yeah.
Of course, thanks, Lise. And thanks for being my button pusher. That was helpful.
No problem.
The other thing I noticed in your list earlier on what makes successful programs, and I mean, I know you had to be selective and take out 3, but one of the ones in there was prepared staff, right? Prepared teachers, prepared competent teachers. And I know in a lot of the recent APA literature over the past 5 years, especially, that is the factor that stands out the most for people's dissatisfaction in programs is unprepared staff, right? Or staff who don't know anything about disabled bodies, or so I'm glad that was on the list, like the prepared staff, of course. But I mean, we've been presenting over the past couple of years, and one of the things that we've noticed is that people say they want to be involved in these kinds of programs, but then when they actually get involved in the programs and they find out they're kind of not as romantic or I don't know, sweet and lovely as they had expected them to be, like yeah, you're going to have a good plan, you're going to have to be focused, you're going to need to learn things, you're going to have to do different things for different people, it's not a one size fits all. The kids you work with aren't going to adore you and obey you simply because you're you. So we get people who come in who believe they're interested, and then it turns out, well, they don't really like kids. So please stop working with them right now if you don't like them. But so they don't really like kids, but more to the point that they say things like this. I didn't sign up for this. I've heard that phrase over and over again. I didn't sign up for this. And I want to wonder, well, what did you sign up for? Like, you knew you were coming into a program that required accommodation. What do you think was going to happen? So I'm wondering if you've had experiences with practitioners similar.
Oh, completely. And I think that's one of the most frustrating aspects, because you just want to shake them and say commitment is important, but you can't do that. But yeah, definitely we saw that. And I think we had the advantage that we could pull volunteers from the kinesiology program at Laurier because they need hours. So that was great. But then it was this idea that, oh, this isn't really what I signed up for. And I don't really want somebody slobbering all over me, or I don't want to have to change diapers. And it was like, well, what did you expect? So it's frustrating. And then the other aspect is, like, we really tried to drill it in that commitment and predictability is so important. So if you have a one-on-one child you're working with, you have to be there that each week, because you don't. And that could really make their whole week really crappy. So,
yes.
But midterms come, our project comes along, and then we lose our volunteers. So I think seeking out, and what we saw and what we learned from that is that actually making volunteers fill out an application and fill out what they knew, and then and then at least you wean out the ones that aren't as committed, because then they don't fill out the application, and then you're like, okay, well, then you would have dropped out anyways. So then we became a lot more strategic, but then it's a balance because we need them. So we're being strategic and we can only pull a handful. So then it also impacts enrollment, right?
Yeah.
So,
yeah, we've been doing the same thing, doing applications and interviews. We follow up with some interviews, and it has allowed us to enlist more committed, more dedicated, more realistic people. But as you say, you know, it's the kind of field where you need lots of warm bodies, right? You need volunteers to be in there, and you want them to like get a taste for it and then be motivated to stay, right? But we've done the same thing, an application process and an interview process. Yeah.
Yeah, that definitely helped. But again, I think that's a struggle that, well,
yeah, it's a struggle.
It's indeed.
Sure. Okay. All right. So just checking the chat here, and that's great. So Erica, thank you for the thank you. She's really enjoying these workshops, and we're glad you're here. So that's great. Okay. Any more questions or comments? Well, seeing none, we're not going to wring out a wet towel. We're not going to try to wring out a dry towel. So, so thanks everyone for being here today and for participating. And thanks so much, Brianne, for coming back to Brock and to our research center, which really is an extension. The research center grew out of our S.N.A.P program. So it's kind of come full circle that way, which is nice. So yeah, and we're glad that you're a supporter. And I'm hoping we're going to be able to continue our collaborations going forward. This is great.
Of course. Thank you so much for having me.
Thanks. And thanks to everyone